Isn't that exciting? The same food we enjoy can help us to improve our health. So I do have professional training in this. I am a nutrition and dietetics student on a master's program, but I also have a bachelor's in the same field. So you are in safe hands. And a little brag, I have an award as the Outstanding Nutritionist of the Year 2022 and second runner-up for the award from the Ministry of Health for the year 2025. So I believe that we are in safe hands. And I want this to be an interactive session where we have an opportunity not just to learn about what we eat, but an opportunity to actually make the changes. It's one thing to learn, it's another to make the changes. And as you can see, my background or video selected today is a beach because I thought, what better motivation for someone to eat healthy than to be able to enjoy their life? So if you're the kind of person who wants to be able to enjoy your life, that means the quality of life, then you definitely have to eat healthy. And today I'm going to ask a question. In addition to what you ate today, is there a place you can buy a new body? Does any of you have a place where you can buy a new body? I don't think the answer is yes for anyone. And if there is a person saying yes, they could be saying maybe a knee replacement. I could wait to have an organ donor for one of the organs that are failing, but that means that you're definitely getting something synthetic or a replacement from someone who has decided to offer an organ. And if bodies are that valuable, that means we need to take care of them. So, how is your kidney? How is your skin? How is your liver? And this question reminds us that in addition to eating healthy, you need to do health screening. You need to go out to the hospital, check your blood pressure, check your blood sugar levels, because it's important to know, and if possible, know early in case there is a problem. Early screening saves lives. And after screening your body, you definitely have to take action. For some of us, at the health facility, we are measured for weight and height, and the doctor or health worker there would say to us, you have slightly overweight, or they'll say to us that you have underweight. So in that case, you have to be sure to modify your diet so that you preserve your health. What have you done for your health today? And we know that you don't want to be among the people who have to take very large expenses to cater for your health bills. A number of you could be insured because it's wisdom to have insurance, but in addition to that, it also costs you the quality of your life. And if you want to enjoy your years later in life with a good quality of life, then you must eat healthy. When I ask the question about what did you eat today, many times I get verbal illustrations of the meal, but sometimes I get pictures of plates like this. This is becoming a normal in the Ugandan workspace and also our homes. Surprisingly for me, even our children are sometimes served food in this format. Not necessarily the portions as you see them, but a large percentage of carbohydrate. While we have typically a family dinner with two types of carbohydrates, there'll be some matoke, there'll be some rice, or there'll be some posho and some potatoes at the same meal. Typically, the vegetables are used as an ingredient in the sauces, as you see in one of the pictures, where there are a few tomatoes, few green peppers, just as a way to cook the sauces. And the sauce is typically something that's just additional to the food. Now, when we look at these plates, many of you say, but that is not junk food, because people believe that eating unhealthy means eating junk and eating healthy means eating local food. Well, these are foods that are in their whole form. The proportions that are on these plates can be concerning for individuals that live a sedentary lifestyle. And by sedentary lifestyle, I mean the individuals like those who wake up 6 a.m., rush to office, sit at your desk. Sit at your desk through up to 5 p.m. At 5 p.m., get into your car or a taxi or a boda and get home. Reach home, sit on your couch and watch something on the TV or on your phone, and then sleep and then go back to the same routine. That means in the day, over 24 hours, you're not active. Those are people with a sedentary lifestyle. So eating as you see on the screen, when you have such a lifestyle, can be detrimental to your health. And we are going to understand why. On the Lear app, we allow people to share pictures of their meals. And over time, we have realized that when we see people's meal pictures, the ones that we have shared before, the plate with a lot of carbohydrate, we see people gaining weight over the years. That means that a banker comes in for their first job in the first year, they will have, let's say, 60 kilos. By the end of the first year, this banker may have 70 kilos. And these 70 kilos have been gained as 10 kilos in 1 year. So if this banker or person who works in an office works for another 5 years, they could gain 50 kilos in the next 5 years. And then you have an individual who started off their career at 60 kilos, now at 110. And part of the problem is the excess carbohydrate intake from the meals. In addition to that, we also notice that there are individuals who will have a higher likelihood to have excess blood sugar. That means they will be diagnosed with diabetes. So excess weight, diabetes are highly linked to the kind of plates that you have. And I'm asking you on this call to modify your plate one healthy plate at a time. When we speak about healthy eating, we are not asking you to eat what you don't like. We are saying, pick out that item you like. For example, if it's chicken, pick the chicken, have vegetables on the side. If it's matoke that you like, pick out 2 fingers of matoke, have some eggplant and beans on the side. Those are 3 food groups: a carbohydrate for your energy, a vegetable for your source of fiber, and protein for your muscles. On the other side, you could be at a buffet. For example, today's lunch may be in a workshop. You cannot eat every single carbohydrate on that buffet. You eat some rice, some potatoes, some white rice, some brown rice, some kalo, plus the white posho. That's a lot of carbohydrate loading for a person who might be defined as sedentary. That means not that active. And if you've noticed and you're familiar with individuals who tend to have a lot of these buffet meals and do not respect the idea of picking just a portion of the carbohydrate, over the years, like I have mentioned, they will have not just an increase in body weight, but an increase in waist circumference, which is the circumference around the abdomen, which people love to say, I have belly fat or I have fat around my abdomen. The message here is, we don't want an empty plate. I need you to eat. But the proportions of your plate should not be filled with just one food group. They should be filled with a balance of the protein, the vegetable, and the carbohydrate. In the event that you've listened to a nutritionist before, this seems like the same story that you hear. And I'm going to convince you on why the same story is actually impactful, but probably you just haven't yet put it into action. Like I said, the healthy plate does not mean you don't eat certain foods. The healthy plate can also mean if you want to eat a chapati, you could eat half a chapati, have your beans, and add avocado to them. So that way, you're doing moderation instead of restriction. And that means it's affordable and realistic for you to eat healthy in whatever situation you are. If you're a local food person, then that's the kalo. A portion of kalo, your portion of vegetables, and your portion of fish. If you like posho, that's posho, some meat or liver, and lots of intula. If you don't like intula, those could be vegetables. And I hope that what I'm asking you to do is not that hard, because I'm pretty much just saying, whatever you have access to, just pick a vegetable, a protein, and a carbohydrate. The carbohydrates are typically what we call the food, emele, or the solid foods. The protein are typically the sauce. And the vegetables, one of us is not muted, are the other portion of the meal. When you choose to use the healthy plate, you will notice a number of things. One of them is, over the months, you will have a reduction in body weight. In the last Majestica call that we had, I had one of us listen in around September, and by January, they say they had lost little over 8 kilos just from using the healthy plate. In addition to this, for those of you who have friends, yourselves, or a relative who is diabetic, Using the healthy plate model means that you're loading just a little carbohydrate. That means your body has a balance. It has less glucose coming in from the carbohydrate, for example, this tiny piece of posho, and it does not overly spike your sugar levels. And that means you'll have better control of your diabetes. The healthy plate also gives you an opportunity for those of you like me who want to make sure that you age gracefully and stay healthy for years and productive and self-helping, able to do exercise even at the age of 70. Your protein portion is a must because it helps you to preserve your muscle mass. And for the ladies, it also helps you to improve your skin health because the protein helps you to make collagen. And I want to do a myth buster right now. I see a number of ladies buy collagen supplements at hefty prices, very high prices. Unfortunately, these collagen supplements that you swallow when you're not eating healthy will not help you. As a matter of fact, you're only wasting your money. The collagen supplements work in such a way that they trigger your body to make more collagen to keep your skin youthful. But if you're not eating protein, for example, your portion of meat, your portion of fish, or your portion of beans, then your body cannot trigger the production of the collagen. So the collagen supplement you just swallowed does not really help you. And that also applies to people who exercise. In gym, for example, the gentlemen are more likely to want to build a certain level of muscle mass. If you're not eating your protein, you cannot build muscle. And yet, interesting literature recently notices that people who have a good muscle mass tend to live longer and live healthier lives because muscle is more active and it keeps your glucose control in check, but also means you're more mobile and you have more mobility because your muscles are firm. I hope that each of us is getting convinced to use what we call the healthy plate model. And in case you want to be able to track how this plate is used, you can share a picture with us on the Leah app, and we'll do an interesting thing where we tell you how much protein you've eaten, how much you're helping yourself to lose weight, or simply how much you're helping yourself with taking in enough iron. And a number of people end up improving their health, for example, controlling their sugar levels and reducing 20 kilos or more in excess weight, just like the image you see of my client Damali. And fun fact, even when you're a postpartum mother, you can use the healthy plate and still maintain a good milk supply, just like the lady you see on your screen. She was postpartum, breastfeeding her baby. She breastfeeds her babies up to 2 years, and exclusively for 6 months, she was able to lose her pregnancy weight, but also ensuring her baby has enough milk. And with just one technique, the healthy plate. So it's possible for us to improve our health with just a simple rule. But then most of us do not actually implement because we feel maybe it's hard to eat enough vegetables. It's not cultural for you to have more vegetables on your plate than the food. But remember, everything is learned. Even the fast foods you enjoy so much, you learned them. Someone introduced you to them and now you like them. So you need to give the healthy plate a chance, at least one meal a day for the start. So a hack is you can go home and say, now all the dinners will use a healthy plate. When you perfect your dinners, then you go to perfect your lunches, then you go to perfect your breakfast. Remember, the healthy plate technique is 50% vegetables, a quarter of it, 25% carbohydrate, and a quarter of it protein. I love the healthy plate because on calls like this, I will always get a person not to call me after 3 months and tell me, I have lost weight, I have better blood sugar control, I feel healthier, I feel stronger. But I also get concerns like, what if for me my goal is to gain weight? Because I noticed I'm a little underweight. For your case, you will have to increase the carbohydrate portion on the plate and make it half the plate and make the vegetable just a quarter. If you want a little more vegetables, you'll have to add more. In addition to that, for those who are trying to gain weight, between the meals, you will also be allowed to eat a snack. So you eat 3 meals using the healthy plate model, but half of it with carbohydrate, and between the meals, you can have a healthy snack. You can eat some nuts, you can eat some fruit. Even when you want to gain weight, your best shot is eating healthy because when you eat your vegetables, you actually have more weight gain because the vegetables give you vitamins that support your body to better utilize the food that you've eaten. And that is why, even for the children, we encourage them to use vegetables because when they eat more vegetables, they tend to have healthier appetites and you do not struggle with them eating enough food. I hope that one of us is probably making a shopping list for vegetables. And let me just look at my time. Okay, I want to leave some 5 minutes for questions. If you've already made a list of vegetables to buy, I also want to convince you and sell you the idea of increasing your fruit consumption. For most homes, you are amazing at shopping the starches. As a matter of fact, your monthly salary is coming in and you've already planned how to stock the posho, the rice, the matoke, the groundnuts, and all the other dry ratios. And you also have a plan on how much of the protein you buy every week. However, for most of you, your houses lack enough fruit. And that means by default, your children and yourself will snack on the biscuits that are available, the cookies that are available, the popcorn, the bagia, the hard corn, and the daddies, instead of snacking on fruit. If your children and yourself snack on fruit, you're more likely to get a good amount of vitamin C. And your white blood cells, the fighter cells, the cells that help you to fight disease, love vitamin C and A and zinc. But for now, let's focus on vitamin C. For years, we have known that people who take enough vitamin C fight off infection better. And COVID-19, the recent pandemic, gave us an example of that. During the COVID-19 pandemic, you and I know that some of us got COVID, but we didn't have crisis situations that needed hospitalization. And we needed to boost our immunity so that your body naturally fights off this virus, which had and still has no cure. That meant that it was your body to fight for you. And guess what we gave our bodies to increase their chances of fighting harder? We gave them vitamin C, we gave them vitamin A, we gave them zinc. If you memorize, vitamin C tablets were hard to get in pharmacies because the demand was high. But the reason we're taking the tablets is because most of us do not eat our fruits. That meant that we have to take a supplement for a source of vitamin C. And studies also showed that the people who are hospitalized, most of them had a low vitamin C status. That meant that you not eating enough vitamin C was more likely to get you into complicated COVID that needed hospitalization. I love talking about this pandemic because it reminds us that the toughest of conditions of our time was actually partially managed by us getting enough food nutrients, which are vitamin C, A, and zinc. And if that's the hardest pandemic we have had in this century, and it was managed for most of us by ensuring we have enough vitamins, what does that say about the human body? It says to us that the human body has capacity to fight if we only nurture it enough. Of course, this is not the case for all diseases, and there are some things that need more action. But a good number of us improved our health with just vitamin C and A. What are the sources of vitamin C that you should be adding to your list or making a shopping list right now? There are oranges, lemons, tangerines, pineapple, tomatoes, hibiscus. And for caution, vitamin C is non-stored in the body. So every single day, you need to have a daily dose of vitamin C. You could eat that cool pineapple with sans, you could eat lemon, you could eat tangerine, you could take tomatoes, but it's also better to have these things in their freshest form. That means that you have the vitamin C without heating it. So for those of you who believe that boiling your lemons makes you get enough nutrients, that is wrong. As a matter of fact, when you boil the lemon, you kill one of the most viable vitamins, vitamin C, that would have helped you to fight off the disease. So make sure you're eating or squeezing out your lemon juice fresh. Maybe you could use the peel for the boiling, but the juice and the core, for you to get enough vitamin C, have it as fresh as possible. And that definitely informs your shopping. You want to shop from vendors that do not have their fruits under the sun. You want to shop from a vendor who typically picks the fruits from the supplier who brings them to the market and sells them in a shed. And it would be wise for you to also pick up these fruits the day they are brought to the market. You can have your border pick them in a refrigerator, keeps the vitamin C more than keeping them out of the refrigerator. And that way, with each meal or each fruit, you'll be able to support your immune system to fight. And again, these diseases are sometimes tough. But I mean, if you could support your body to even fight better than it would without the vitamins, that means you get a chance. And what we see is that people have more fruit in their homes, like those of you who are going to start buying sacks of oranges for your households, or at least for 10,000 every week, you will notice that when your children get flus and colds, or yourself, they recover in a shorter time than before. Even other conditions like malaria, because while the anti-malarials will be the ones treating the malaria and killing the malaria-causing germs, the vitamin C will be empowering your immune system and helping you to have a stronger fight. So please add fruits to your weekly shopping list. For now,
Thank you.
I will end there and have questions, and later on have just a small segment about productivity and anemia.
Thank you so much, Regina. Joanne here. I am at Makerere University for grad. It's been exciting here, but I just wanted to share the questions that have come through the chat. One of them is asking what kind of fruits and vegetables should a person with diabetes eat? Another person was asking that the fruits that you have listed are acidic. What about if somebody has ulcers? What do they need to do? The other question was about, do you also kill vitamins if you put lemon in warm water? Those are the questions that have come thus far. Thank you.
Okay. Let me start with the last one about killing vitamin C when we put it in warm water. So vitamin C is not exposure to heat, it slightly reduces. That means that the sun will reduce it a bit. Warm water will reduce it a little bit more. And boiling it will reduce it to a very large extent. So that means that if you really must, take your vitamin C without any heat. If you want to make lemon tea, you could use the peeling part. But I'm just saying that if you make lemon tea and that's the goal of the dish, to make some lemon tea, you don't get as much vitamin C as a person who has eaten the lemon or squeezed out the lemon juice. Yes, the fruits for vitamin C that I have mentioned are acidic. And for people who have ulcers, which it means a wound, ulceration is a wound in your stomach lining, you tend to react to foods that are acidic. But I want to remind us, one of the questions I asked first at the start is, how is your body? How is your liver? How is your kidney? How is your stomach? So in the case of stomach ulcers, in Uganda, many of you have symptoms that are related to ulcers because a friend told you, and then I'm not saying this is the case for a person who asked, but it's common, so I'm addressing it. And you also say, because of the symptoms I have, I believe I have ulcers. But I'm really asking you to not just assume, but go for an actual checkup to know what you have. We have people with gastritis, we have people with heartburn, esophageal reflux, where the content of the stomach refluxes back up and creates a burning sensation that comes from bottom up. Those are different conditions. And as a matter of fact, an ulcer is a wound. So if you have ulcers for a lifetime, that means every single day of your life you have a wound in your internal area. Yes, it's true, some of us have these wounds. And the commonest are caused by a bacteria called H. pylori, which we typically test in your stool or your blood to see if there is a bacterial cause of the wounds in your stomach. Where am I getting with this? It's true that the acidic foods irritate a person with ulcers, but it's also true that if you get proper medical management, you will overcome the ulcerations. A largest percentage. That means that you'll be put in a situation where your stomach or gut is back to normal and you can go back to enjoying the lemons, the tangerines, and other acidic foods. However, in the time when you have an ulcer that is active, you don't want to take these lemons and oranges. You will take them maybe if they're very diluted, but if you can't, it's okay to compromise on the vitamin C intake, but make sure that this compromise is short-lived by you going for medical treatment so that the ulcers are treated. And after that, you'll be able to enjoy these vitamin C sources. Alternatively, you can take a supplement if it does not also irritate you, because by nature, vitamin C is an acid. For those of you with diabetes needs a control of how much glucose you're taking in. And that means that controlling your total carbohydrate intake, that means the sugars, encourages you or your body to have just a small dose of glucose coming into your blood. On the picture on your screen, you notice there's someone who is eating potatoes, a small amount, not a full plate. That means they have a good portion of carbohydrate. They also have vegetables on this meal. So what happens is the potato will be broken down to glucose, and the vegetables will help to keep the food longer in the stomach, so they reduce the spike in sugar levels. That means that the sugars will not overly go up because the portion is small of the carbohydrate, but also there's fiber that helps to reduce the spike. And this is what we call good blood sugar control. However, there is a mistake on this plate if the person is diabetic, because this individual chooses to have mango and potato at the same time. Remember, both mango and potato are sources of glucose. Of course, the sugars in mango are easier to break down because they're simpler sugars. They are more sweet, so they're easy to break down. Having the potato and the mango at the same time is a mistake, because that means if the potato raises this individual's sugar levels to 8, for those of you who are diabetic, you know these numbers, then you add a mango, then it also adds maybe 10, then you'll have sugar levels post-meal that are 18, which is dangerously high for you. How do you address this? If you want to eat fruit, you eat a portion of fruit, typically a portion the size of an apple. So you would eat like half a mango, size of an apple, or you would eat a banana, one sweet banana. Physically, we also use a fist to measure your carbohydrate portion. But if you're to eat the fruit, you eat the fruit and you leave out the potato. You eat the fruit, you leave out the matoke. You eat the fruit, you leave out the rice. That way, you're having just one single source of carbohydrate at that one meal. With that, you're able to eat your fruit in controlled amounts. That means you don't have spikes in sugar levels without missing out on the vitamins, but without damaging your blood sugar control. However, this is generalized information, and in meal plans, we typically also go into the details of which fruits the person can eat and which ones they cannot, because individuals have different tolerances. If your blood sugar tolerance is good, you can eat a portion of a fruit, a fist-sized portion, in replacement for the carbohydrate. If your sugar control is a bit not so well done, I encourage that you stick to having a personal dietitian plan out your own meals. Typically, common thing is we'll eat the fruits in the morning after fasting when our sugars are a bit low, and then during the day we use the whole carbohydrates like potato because they have a slightly lower spike in sugar levels. But that also reminds me of the fact that these sessions are for general information. The best results I get as a dietitian are from individuals who get a personalized plan. That means we calculate everything to the core, and this can be obtained from the Lear Dietitian app for best results. So in case anything I said today does not give you a good result, or you feel it knows that it will not work for you as an individual, please reach out. I'm going to put my number in the chat, or download the Lear Dietitian app. Just take a picture of your meal and we shall give you insights on why your meals are not improving your health or where improvements need to be made. Yeah, I noticed time is up. I wanted to mention something small about iron, but I can be guided by the host.
Yes. 1 minute. 1 minute, please, so that, yeah. 1 minute, then we...
Okay, I'm going to use my 1 minute in twos. One is Ugandans. Stop
Yeah, please.
encouraging each other to take excess alcohol. On Fridays, most of you bully your colleagues, your adult colleagues, into taking excess alcohol. There is a problem with alcohol use in our country, and excess alcohol elevates your blood pressure. Some patients come into hospital, we tell them to moderate alcohol, but because they fear to let go of their social lives, they keep drinking excessively on the weekends, and this impairs their blood pressure control. Please stop encouraging people to take on habits that are unhealthy. Many of you who sit in a bar and you keep telling your friend, you're weak, why aren't you drinking? Please stop it. Be your friend's keeper. Love people by not encouraging them to have unhealthy habits. And number two, to the ladies, we are more likely to have anemia. That means you go to the hospital, they check your blood, and you have a low hemoglobin level, concentration, and that's what we call anemia. Anemia makes you sluggish, it makes you fatigued. Why? Because your body is not able to carry enough oxygen to the different parts of the body. And sources of iron help you to prevent anemia. We have meat, we have beans, we have booger, and this is why I want to emphasize this rationale of saying meat is bad is a wrong idea. Unless you are vegan for religious reasons or other reasons that you choose, please ensure that you have some animal protein in your diet, unless contraindicated. Liver, meat, in moderation, of course, and when the fat is off, because these are amazing sources of iron, and iron helps us to stay active, helps us to reduce the chances of giving birth to children with birth defects. Thank you for listening to me, and I hope each of us will use the healthy plate model to improve our health and also the health of our loved ones. Remember, healthy eating should not be boring. Use what you like and make a healthy plate out of it. Thank you for having
Wow.
me.
Thank you, Regina. Thank you so much for sharing. I know to many it's the bitter truth, but we have to take it. Thank you very much, and maybe thank everyone who has joined. I hope you are able to see what I've shared on the screen, our upcoming events from Magister Training Associates. We have in April the Invaluable Laws. And I encourage most of you, all of you, to participate. So please register so that you're able to join this masterclass. We also have a TOT from the Start and Improve Your Business Trainer of Trainers. Please, that is coming up also soon. So please also register if you want to be a business trainer and you know business is the way forward now. So please, it's good that you also register. And next month, the month of March, we shall host my namesake Francis Musingozi, who will be talking about thrones and roses, navigating the pains of leadership. I know all of us have struggled in leadership, personal leadership, and organizational leadership. So please don't miss next month, last Thursday of the month. Join our lunch and learn and encourage others to join. Otherwise, thank you so much, Regina. Thank you, everyone. And maybe if Joan has one or two things to say so that we call it a day so that you're able to go for lunch. Thank you.
Thank you so much, Francis. Thank you so much, Regina. Thank you for keeping your promise. You had promised us that because the other time the presentation didn't go well, you will do it again. You have done a fantastic job. I think the onus is on us to implement what you have said. Let's all embrace the healthy plate if we want to live longer. I think the world needs us. It needs the different things that we are going to do. And yes, just like Francis said, we have exciting programs coming ahead, the lunch and the masterclass, and this is really a drive towards personal growth. So we encourage you to sign up for it. It's going to be an online course, and we will really journey together. And I'm so excited to have Francis Musingozi. He was my former boss. And I'm just so happy to host my former boss in this platform as well. Otherwise, over to you, Regina, for parting shots so that you give us the last final dose of what we really need to do so that we, and thank you for sharing your phone number there. People, please call the dietitian and check that we are eating healthy. She has shared her number there, and let us all live more healthy lives. Thank you so much. And over to you, Regina, for your last parting shots. Thank you, Francis.
Thank you very much.
Opportunity to say hello.
Thank you, Joanne, for having me, and thank you all for listening in. We are 44 of us on this call, and I hope that the 44 of us will eat healthy at our next meal. You don't have to overplan it. Just go for your next meal at that restaurant you're going to today. They will surprise you. If you order for an extra portion of vegetables, they will have it. If they resist, tell them, don't you have any tomatoes? At least cut up for me some tomatoes. Don't you have an avocado? They will address your need. Sometimes it comes at a slightly extra cost, but it does modify your health. At home, on the weekend, modify your health by changing your shopping list. Twitch it a bit to just add a list of vegetables and a list of fruits. And then later on, work out on recipes that you enjoy in your house. Make sure healthy eating is interesting. Remember, if it's not enjoyable, you're going to drop off. If it's enjoyable, you're going to do it for life. Healthy eating is not about starvation, it's about nourishing your body. I look forward to hearing your testimonies, and in case you struggle, please call me. I can be your accountability partner because I get people to lose a number of kilos and improve their health with just food.
All right. Thank you, Regina. Regina has shared the slides. And then we have also Ruth has been able to share the registration for the Invaluable Laws, the masterclass. And then also she has shared the registration for the Start and Improve Your Business TOT. So please register. And then we shall also be able to share the recording for those who have missed. Someone wants to share this recording with others. Yes, I think it's also good that we share the recording with those who have missed. Otherwise, thank you very much. Enjoy your lunch and bye.
Bye. Enjoy your healthy lunch.
A healthy plate. Enjoy your health.